We're going to now introduce, I don't know if you're all familiar with Nurse Barb. Barb Dehn is a nurse practitioner here at El Camino. She's also a TV personality, has her own TV show. And we have our first patient story that we're going to introduce, and I'd like to turn it over to Barb.
Thanks, Dr. Kirtala. It's very nice to be here. I'd like to ask Keith Angelo to come up, please. And while Keith is getting himself settled, and I'm going to have you be right by this microphone, I just have to say, I love the attention span of this room. You guys are not high school students. I mean, you would have been texting and sending tweets to your friends. And we got this amazing information from Dr. Gaudiani and Dr. Joy. And wasn't it better than going to Google University? How many of you? I love this because we're learning so much about how the heart works. And I have to say, when you have a family member or you yourself are here in the hospital, it's overwhelming, isn't it? How many of you have had a family member or been a patient here yourself? So you know how overwhelming it is, and you're trying to take in all of that information about what does this mean? What is a heart valve? What does it do? Does it help to hear now how it works? Because you can listen. And I want to invite you, if you have a family member or a friend who is here or comes here, do come and visit them. Be that person who says, I heard about this. I can help reassure you. Of course, you want to let their healthcare providers and the whole team work. But having a friend who knows a little bit more is very reassuring. Before I talk to Keith, I just want to say that I used to work at Stanford. I worked in the pediatric intensive care unit. I was privileged to take care of the first children who had heart transplants. I know as a nurse working in the trenches how important it is for you to have a good team. And I have to say, from what I've seen here at El Camino, you have the best teams. You have the Fogarty Institute, you have cardiovascular surgeons, cardiologists, highly trained nurses. There's a reason El Camino wins all these awards. It's because you are getting some of the best care, not just in the Bay Area or California, in the world. You're very fortunate to be here. So I want to introduce you to someone I just recently met. This is Keith Angelo.
Good morning.
Can everyone hear Keith? And Keith's wife, Luana, is here if he can't remember what to say. But I had the pleasure of interviewing Keith this week. As you can see, Keith is a very fit gentleman. In fact, he's not going to tell you, well, maybe he will. He runs 3 miles a day, every morning, right? Is that right?
Mostly, yes.
Mostly. And then he walks for a half hour every afternoon. You eat well, you're fit, and yet you have a family history that put you at very high risk for heart disease. You get preventative checkups. You've been taking medication for years. You've gotten screening echocardiograms, stress tests. What motivated you, Keith, to be so proactive about your cardiovascular health?
So let me just start from the beginning. I come from India. And as some of you may know, we have a very high rate of heart disease in my country, where I came from. This is now my country, so I'm talking about my origins. The second major risk factor for me was I had a very prolonged and well-established heart disease on my mother's side. So I was well aware of the fact when I was growing up that I did have a high risk of heart disease, and so I tried to do everything I could in my power to make sure that I didn't come down with it. So to answer your question, Bob, I started early on. I tried to be regular with exercise, diet, And I also went very early on to preventative care, South Asian Heart Clinic here at El Camino Hospital, which does an extremely good job in making people aware of heart disease. I also went to a cardiologist very, very, very early on in my 40s before I had any sign of any heart disease. And I was hoping that by being proactive, by being on top of things, by going for an annual physical, annual stress test, keeping my cholesterol under control, I would be able to avoid heart disease. Unfortunately, it didn't work. So
you did all of the right things. You went to the Berkeley Heart Lab. You got your cholesterol level checked. You made an acquaintance with a cardiologist. Was there, and you took medication for years and years, and you did have a cardiac event, which we're going to talk about in a moment. But as you were doing that, how did you stay motivated? Because I know a lot of us, we don't see ourselves as sick. We're about prevention, right? We don't see ourselves as having a heart condition or high blood pressure. So it's really hard sometimes to stay motivated to take your medication. So Keith, did you ever wonder, is this really necessary? And why did you stay with your medication?
Well, for one, because my wife said she would disown me if I didn't. I also have 3 children, so I was motivated from the fact that I was a father. I had to provide for the family. But most importantly, I think I was just aware of the fact that I did have this high risk. And the cardiologist that I was visiting at the time, put me on a statin. I've been on a statin for over 10 years. I've been a runner for over 25 years. And I felt, well, I've, been in pretty good shape health-wise. And actually, I will share one thing with you. I know it's difficult to exercise, but I will tell you, once you get into a routine of exercise, it's very hard to give up because you just don't feel good anymore. So it just became part of my lifestyle. I ran every morning before going to work. If I didn't, I felt like a slug, to be honest with you. And, I kept that up for 25 years. And I have to also share something with you. I find it very hard to take any medication. So just taking medication was kind of an antithesis for me. It was like, I don't like taking medication. I've never been in a hospital in my life. I've never had anything go wrong with me. I still have my appendix and I hope most of my brain. But, just never had anything go wrong. So to pop that statin every night was something that I had to force on myself. And my wife will share with you that we've had many heated discussions about the fact that I wanted to stop. And I would, constantly argue with her about, I'm on this statin, why am I on this? There's nothing wrong with me. I've been to stress tests, I've been to, the doctor every 6 months, my numbers are all in line. Do I really need this? And she, in her own calm way, would say, well, I agree with you, but before you do anything, go talk to the doctor. And, I would have this discussion with the doctor, and of course he would say, well, I would recommend you continue on the statin. And I'm really glad I did, because I don't think I'd be here talking to you if I didn't. So the thing I will share with you is that the exercise and the statin, I think, is what got me through it.
So what happened, if you don't mind telling us, what happened on the night of January 23rd, just this year?
So it was a regular day, came back from work, and basically it was a Thursday night. We have a son in college, so I was on the phone with him in bed. It was about 11:30, and my wife and I were both in bed talking to our son on the phone, and I was holding the phone up. It was on speakerphone, and we had a lengthy conversation. So when I put the phone down, I kind of felt a little crampiness in my hand. I thought, well, it's been a while. I've been holding the phone up. Must be that. So put my arm down, and I absolutely had zero symptoms prior to that. Absolutely zero. Had dinner. It was a perfectly good evening. Nothing. Absolutely no indication of anything. But it was a classic foil one, bullet one that you see when they talk about heart attacks. Tingling in your finger, pain going down the left arm, and then within 2 minutes, growing chest pain. So I got up, figured I'd get a glass of water, and that would be it. My wife, in her infinite wisdom, I told her something was wrong, got on the phone to a friend of ours who's the director of the heart clinic here at El Camino and said, well, this guy's complaining or something. In the meantime, I go to the kitchen, get a glass of water, come back to the bedroom, and by now I know I am in acute pain. The one thing I will share with you is this is unlike any other pain you've ever had. It's not like somebody hitting you from the outside or poking you. That's a different kind of pain. This is a pain that comes from deep, deep, deep within you. It's like a vice. The only way I can describe it, it's like something really inside of you, not your skin paining. It's like a muscle that you've never, ever felt before squeezing down on you. And at that moment, I knew I'm going to get to the hospital. So, I put my clothes on and was in the car before my wife got into the car. Now, maybe that was a mistake. Maybe we should call 911. But we were here at El Camino. We live about 5 minutes away, so we were here very, very quickly. So I don't know if you want to ask me more,
yes,
more questions.
I want to know. I want to, and there's a lot of people whose heads are nodding, and I want to say that sometimes women's symptoms of a heart attack are different than men. And I'm going to ask Dr. Curatola, just to stop for a second. Dr. Curatola, can you tell us, does everyone who has a heart attack have crushing chest pain or that burning? Or
Absolutely
do some people
not.
present differently?
People present as differently as they look. And I've seen everything from very, very subtle signs and symptoms. One individual used to just get a buzzing in his hand without anything in his chest. People have presented with symptoms that made them think of bursitis. And so that elephant on the chest, which is, of course, the quintessential sign, and what we call the Levine sign, when somebody's grabbing their fist and holding in tight on their chest, those are a subset of the people that present. So you need to look at your risk profile.
And so women sometimes will have the burning. They might feel nauseated. They may sweat. Now, I'd like to ask you, Keith, to go on. Tell us what happened when you got here to the emergency room.
Well, I'll tell you something that happened before I got to the emergency room, which is the same friend of mine that my wife happened to call had sent out an email about 3 or 4 years ago that said, if you're feeling like this and you're on the way to the hospital, try coughing. It helps. So here I am sitting next to her in the car, and I have this acute pain, and she's reminding me to cough. So I did cough, and I don't know technically and medically whether that helped, but it sure felt better. And I coughed all the way from our house to the hospital. We ran into one red light. I remember that clearly, and I was praying that the light would change, and it did, and I kept coughing. And then my wife almost overshot the right turn to El Camino Hospital. And I had the presence of mind to remember, oh, no, El Camino Hospital is this way, Pam's that way. So we turned. And we did get here very, very quickly. Now, I think God really was on my side because Dr. Chad was on duty and he was already here, so I didn't have to wait for him. And thank God for El Camino Hospital. I got here, it was about midnight, a little before midnight, and I staggered into the emergency room and managed to get to a chair. I was in acute pain, I will tell you that. It was tremendous pain. But everybody was so kind. They did an EKG on me, and I guess it showed up that I was absolutely having an episode. And I remember, I believe it was Dr. Cook looking at me and asking me whether I was in pain. And I said, yeah, I think it's like giving birth. So yes, something's happening. And I said, well, what's the EKG showing? And she said, yeah, don't worry, Dr. Chad's on his way. And so the next thing I remember while all this was going on was lying on a gurney and looking up and seeing this face in my face, and it was Dr. Chad with his mask already on. I said, oh my God, he's already here. And he looks at me and I said, "Doctor, tell me the truth. Am I having a heart attack?" Because I was still thinking I'm having some kind of indigestion or, so I was not having a heart attack, And he looked at me and said, "You are having a heart attack, and I'm 99.9% sure of it." And I said, "What about the 0.1%? And he said, no, you're having a heart attack." And that's the last thing I remember, because I think mercifully he put me out. And I asked him about it later, and I said, "I don't remember anything. I've had friends who've had heart attacks, and they had the whole TV show. They were lying there, and you saw the catheter go through, and you saw this whole thing, and you were talking to them and everything. And, how come I didn't have this experience?" And he said, "Well, I have this special drug, and I wiped out your short-term memory." And I said, "What a shame. I'd love to be able to remember what happened." But anyway, kidding aside, I just want to say thank you.
Thank you so much. Let me...
To him and to El Camino.
We're not quite finished. We're going to keep you up here. Dr. Chiarotola, can you speak to the coughing first, and then I want to speak to timing?
Yeah, I think one of the things that was good about that is that you took your mind off of things, and you were certainly doing something to help yourself. And so that really helps. But most of that is also to try to keep your blood pressure up if your blood pressure is low, and also can help you in terms of you having any kind of arrhythmias.
I want everyone to see you.
Hi, Mom.
Yes. So tell us about this timing issue, because I think your timing from the time you were diagnosed to the time you were in getting a stent was pretty rapid.
So I came in and saw Dr. Chad 2 weeks after I was released from hospital. So let me finish the story. So I did have a heart attack. It was diagnosed as 100% a blockage of my LAD, which I think is called the widowmaker. So, and Dr. Chad was able to go in there, put a stent in, and fortunately I got here in time where it all went well. And I was back on my feet in 24 hours. I was in intensive care for a day. I was in the hospital for a total of 3 days. I got back home, and from everything that subsequently has been checked and rechecked, I'm doing okay. Some people may have a different opinion on that, but I'm here. And I've been back on my exercise routine. I am now in cardio rehab. And what happened was Dr. Chad put a stent in me, one stent into my LAD, and supposedly I think that took care of it. Now, why this happened, he and I have had discussions about why this happened, why really did the blockage occur at that one particular place. I don't have the traditional narrowed arteries. I don't have the traditional heart disease that you hear about. And I think, like he said, there are some things you just can't explain, and you leave it to God.
Yeah. So Dr. Chiarotola, please talk to us a little bit about episode to time to angiogram to time to stent, because I believe that that Keith broke some records here. I think it was a few minutes. It was less than 20. But can you talk to us? What is the time issue?
And I'm sure that Dr. Ramahan will address it in his talk, but time is muscle, is what the term is that we use. And the longer you wait, whether it's a stroke or a heart attack, to get to medical attention, the more damage occurs. And the sooner you arrive, the more you can mitigate that amount of damage. And I think from the moment you arrived to the moment that blood flow was reestablished, from you coming in the door to that blood flow being reestablished, was on the order of an hour, which is a remarkable time. The national guidelines are, the goal is to get to 90 minutes. What we don't know is 60 minutes better than 50 minutes, but we do know it's certainly not worse, right? I mean, so the bottom line is that getting there quickly, recognizing your symptoms, and then getting to an institution like El Camino Hospital with staff and physicians like Dr. Ramahan that are very well greased and prepared for people coming in like that is critical. And that's why you're here.
I think Dr. Ramahan told me it was more like 40 minutes in my case, so it was very quick. But so, I think it was extremely lucky,
So Keith, you recently had a stress test you told me about. How'd you do?
I did very well, thank you. was able to basically, get back to almost where I was prior to my heart attack. I think my levels are up. I've been told I've got minimal damage. And subsequently, I have joined the cardio rehab program here, which is another wonderful program at El Camino Hospital, staffed with wonderful people, some of which I see at the back of the room here, who've taken very good care of me. It's been the end of my second week now, and back to running on the treadmill again, getting my confidence level up, because my wife won't let me do it at home. She's too scared, so I'm here doing it at El Camino. But I think the program helps you build your confidence up, and really that's what I need.
Dr. Curatola, what can we learn from Keith's experience? What can all of us take home from this?
One, make sure you have a wife like Keith has.
You took the words out of my mouth, Doc.
Because I don't know if Keith would be here otherwise. But the most important thing is to realize you have risks, which you do. And generally that family history risk is not your grandfather when he was 85 years old. It's your uncle or your father when he was 48 or 52. It's women under the age of 55, men under the age of 55 and women under the age of 65. That's the family risk. Recognize that you have a risk, get to the hospital quickly, and hopefully get to a hospital like El Camino that has the facilities to help you. The thing to realize, everything in life is a bell-shaped curve, and there are exceptions at both ends, right? And there are people that do nothing right and they live well into their 90s, and there's people that do everything right and they have a problem. But most of us fall underneath. So I would encourage everybody to really look at the choices that Keith has made and understand that in all likelihood, had you not made those choices, had your doctor not put you on statins, had you not become a runner, that what you encountered may have happened much earlier and before you had an institution with the facilities that we have to rescue you. So the half-full side of your glass is you made some really, really good choices, and that's probably part of the reason why you're here. I have to make an announcement. This is out of order, but if you're parked in front of the hospital, the fire chief and hospital supervisor would like you to go and move your cars immediately, because it's a fire and emergency risk. I think that translates into they're going to tow you and ticket you if you're out there. So sorry for the interruption.
So Keith, when we talked, you said that you're a cake and cookie guy, and like me, you're addicted to dark chocolate or chocolate. So can you please tell us, how are you dealing with these chocolate cravings now? Because some of us, it's hard for us to give up our favorite foods.
Not very well. So my one weakness in life is sweets. Mm-hmm. My one indulgence was basically consuming cookies and cake at 4 in the afternoon. That was something I look forward to. I was not really an out-of-time eater or between meals. Pretty much ate, regular good food, which again my wife cooks. But the one indulgence was sweets. Unfortunately, of course, I've had to give that up completely. I'm kidding. I have kind of dealt with it. The dietitian from the South Asian Heart Center has worked with me very closely in developing a new, more vegetarian diet. So no red meat, chicken and fish, lots of vegetables, lots of fruits. So I have this mantra stuck in my head that the cardiologist told me, 2 fistfuls of vegetables, 1 fistful of fruit, 10 almonds a day or 10 walnuts. And the one indulgence is dark chocolate-covered almonds from Trader Joe's. So I have that stashed in the back of my car. But that's about the only thing I kind of give myself to eat. Now, it is hard to do because you have to control that urge to pop a couple of cookies now and then.
So what advice would you give to this audience? You have a great opportunity, Keith, to give some advice.
The one thing I will say is, I know it's hard to exercise. I know it's hard to get into a routine. But if all you can do is at least walk 30 minutes a day, please do that. I think anything is better than doing nothing. That's the first thing I'd say. And then the second thing is, from a diet point of view, you know, there are alternatives. I've just started this, so I'm not going to sit here and say that I've made a major change in lifestyle for the rest of my life. I don't know how long I'll be able to go without, you know, going back to some bad habits. So I'm not going to sit here and preach to you, but it can be done. I'm trying hard. I eat oatmeal in the morning, something that, you know, it's not one of my favorite things, but okay, we know how to make a change. I used to love white bread. You know, there isn't a piece of white bread on the face of the planet that I didn't like, and I can't eat white bread anymore, so I'm eating brown bread, which is something that I don't like, but well, if the alternative is not being here, you know, eat brown bread. That's the way I look at it. You know, so can't eat, you know, ice cream like I used to, but again, if the alternative is not being here, then, you know, maybe don't eat ice cream. So I think that's the logic I keep using in my head. I'm an engineer, so I fall back to first principles, you know, and that's the way I'm trying to look at it. I will say I'm eating a lot more fruit, and I'm beginning to enjoy it. I used to eat fruit, though my wife says I didn't, but I used to eat fruit. I used to eat a lot of fruit. And she tends to minimize everything good, you know, and accentuate the bad. So, but I am eating fruit. I'm eating a lot of fruit. I'm eating 2 apples a day, a couple of, you know, grapes and pineapple, and oh goodness, a lot of fruit, a lot of fruit.
Dried fruit doesn't count.
Dried fruit doesn't count. Fresh fruit, a lot of fresh fruit.
Can we ask Luana to stand up, since you're really you and the are the team here? Can we ask you to stand up? Thank you so much.
And, you know, just basically trying to just lead a disciplined life. Trying to go to sleep a little earlier these days. You know, I was a night bird. I'd read till 2 in the morning after everybody's asleep in the house. So it was like my time. And, you know, I try not to do that anymore. So just try and get a little bit more rest and get my heart healed again, hopefully. So I think just common sense things.
Thank goodness you're here. Thank goodness. Thank you.
And I just want to say thank you to El Camino. I wouldn't be here without him.
Thank you so much.
Thank you.
Thank you, Dr. Curatolo.
Thank you, Bob.
On to you.
I would add one other thing that wasn't touched on here. And one of my father's favorite songs was from Bobby McFerrin. I don't know if you remember it, but it was "Don't Worry, Be Happy." All right? Don't worry. That's a very important part. The mind-body connection is huge. And if you spend your whole life worrying about that piano falling, that's not going to help. So do every one of those things. And don't worry, be happy, and have intimacy in your life. I want to introduce Nurse Barb again, and we have Terry and Bill, and we have another patient story to share.
Thank you so much. So I'm going to introduce Terry Odom and Bill Barry. Do you guys mind sitting here? Would you be comfortable here? And while they're getting set up and Brian helps them with the microphones, I want to ask you guys something. When you see these wonderful videos of angiograms, how many of you are thinking, oh God, I could interpret that? Any of you thinking that? Right? I mean, how many of you have watched the Olympics this year? And you see them twirling around on the ice or doing whatever, and you think, oh, how easy is that? I think one of the things that happens today is we have these amazing presenters like Dr. Curatola, Dr. Chad, Dr. Nori, and Joy, and Dr. Gaudiani. They make it seem simple. They make it seem like you could diagnose yourself, right? Oh, I'll just look at that angiogram. I'm having chest pain. I'll look at my troponin level. But maybe after today you're thinking, well, maybe it's a little bit more complicated. Anybody feeling that way? And that's why you need a team. That's why you don't want to be at home going, well, is it indigestion? Or I'm Italian like Dr. Curatola. Is it agita? Did I have something bad? You want to go to the ER and let the experts with years and years and years of experience and people who are here dedicated 24/7 and have the experience so that they can diagnose you. All right, I have another question. How many of you watch survival shows on National Geographic where, you know, somebody's jumping into a cold river and has hypothermia? Anybody here big fan of Survival Alaska, Coast Guard Alaska? Anybody? No? Yeah, right? How many of you have heard of hypothermia? Have any of you had hypothermia? Not you guys. Anybody here have had hypothermia? I grew up on Kodiak Island in Alaska, right? So I know a little bit, not a lot. I mean, I'm not Coast Guard Alaska. I'd like to introduce you to some folks here who have a different experience than a stent. So we've been hearing a lot about stents today, right? And we've heard a lot. But I'd like to introduce you to some people who found out that it's not necessarily so dangerous to have what we call an induced hypothermia. Someone got very cold to treat a heart attack. So I'd like to introduce you to Terry Odom and to Bill Berry. And Terry, could you talk to us a little bit about your experience with hypothermia? And can you tell us a little bit about your overall health prior to your experience in early February?
Okay, prior to that time, I had recently in August of last year finished being treated for breast cancer with chemotherapy and with radiation, and was that whole process, you become very deconditioned and wiped out. And so I was beginning to start trying to get my conditioning back. And I was just sitting reading at the kitchen table, and that was the last thing I remembered for a week, literally.
So, Terry, you had been treated with adriamycin.
Adriamycin, and there is a small percentage of people that can have heart damage from having adriamycin. And I got to be in that far end of the curve.
So you knew that you had a cardiomyopathy. You had
Yes.
some damage to your heart from your chemo. In fact, didn't you have an angiogram?
Yes, I had had an angiogram just about a week and a half before that. And so we knew that I had a heart failure, basically, and some fluid around the heart. And but other than that, I mean, I had no symptoms, nothing. And like I said, I was just sitting there reading, and fortunately, my husband was home.
So, Bill, I know this can be very difficult to talk about. Bill, you're not normally home during the day. Why were you there that day?
I was only home because I'd gone to the dentist earlier to have a crown set, and it was a difficult crown on a wisdom tooth, so I left with a bloody gum. So he gave me a tea bag to put over and take home and squeeze against my cheek.
Black tea has to be something like Lipton.
It has to be black tea. Lipton, he keeps a stock of Lipton tea bags there for such occasions. And so I was just sitting in the family room watching YouTube videos while I'm pressing this against there, and suddenly I heard the sound like a sack of potatoes falling in the kitchen.
Now, he's from Philadelphia. I still haven't figured out where he heard potatoes falling all the time.
And she had fallen, cracked her head a little bit on the track of the sliding glass door. Because of the other issues, she had been having low blood pressure, so I initially thought she fainted. And because Dr. Corotto over there had done an angiogram and we knew her vessels were wide open, I didn't think it was a heart attack. So my next reaction was a stroke. She was unresponsive, maybe shallow breathing. And then probably the best thing was I immediately called 911. And the Santa Clara 911 dispatchers are superb because he had me check to see what she was breathing.
Told him how to tell. It's not easy.
Right. And I had been trained in CPR a few years ago, and I completely forgot everything I knew about CPR at that point. And walked me through what they now do, which is two-hand CPR. Did that immediately. Told me to start counting. Told me I was going too slow. Fortunately, got to 60, and they were at the front door. The thing I forgot to do when I called 911 was to unlock the front door. Keep that in mind if you call 911 and you're occupied. Unlock the front door. So I had to stop CPR to let them in, but as soon as they came in, they blew our kitchen apart. They now have I didn't know they did this, they now have a hands-free CPR machine, which allows them to start CPR while they're putting on the EKG leads, intubator, use the paddles, which they use 5 times to get her heart started.
Yeah, I was unconscious at that point. Yeah.
Can you imagine? Can you imagine how traumatic that is to have to do CPR on your partner, your spouse, someone you love, and then to have the paramedics come in and do 5 shocks. Now, Dr. Curatola and I were talking. You called their house. Didn't you call their house at the same time?
I don't know what it's a 6th sense or what, but Terry had called me about Bill's bleeding gums because he's on Plavix. And so I initially instructed her, well, call the dentist. They have some kind of gauze. I didn't know about the tea bag deal. And see if they can put it on there. And about maybe 15 to 30 minutes went by, and I'm thinking to myself, let me call him back. I'll get the dentist's telephone number. Being the New York Italian I am, I figured I'll get the dentist's telephone number. I'll threaten the dentist.
He would.
Right? So I call back, and Bill tells me the paramedics were there working on Terry. And then we met, fortunately, in the emergency room. And this is where, knowing your patient and having some information, and even in that entire chaos, Bill had the presence of mind to remember that she had an angiogram, and we knew her arteries were okay, because the first reaction, of course, is to take you to the cath lab, as you heard. Right?
Yeah. I didn't know that going on behind the scenes, because as you saw the statistics, they want to get you in a cath lab right away. And it was very fortunate Dr. Curatola was there because he reminded them. I had said it, but when I said it, it wasn't the same as Dr. Curatola saying she's already been to the cath lab.
So, Bill, then what happens? So all of a sudden we know, okay, we're not going to cath lab. Then what happened next?
They said we're going to put her in hypothermia, which I was familiar with.
And why is that? Can you tell us why?
Well, the part that really got me was years ago I had worked on astronaut spacesuit cooling. And basically it's the same technology.
Although it looks a little different. My daughter referred to it as they made a burrito out of a space blanket. It made me into a burrito out of a space blanket.
And the astronauts wear a cooling suit underneath their spacesuits from when they go outside to remove the body heat, which would get trapped into their spacesuits. And so NASA developed this technology in the 1960s. We were refining it in the 1980s, and we had actually had transferred that technology, and I think it's still currently in use for MS patients. MS patients will wear a cooling vest to relieve some of their symptoms, but I never knew of the Cardiac Care Act application of it.
So Dr. Curatola, please help us understand how we take space-age technology and we use hypothermia to cool someone down. Why would you do that?
You've heard a lot about preserving heart muscle. In this case, you're talking about preserving brain function. And so by cooling the body down to where we're talking around 32 degrees Celsius, around 90 degrees Fahrenheit, there are 3 stages in the hypothermia. One is the induction, then there's a maintenance period of about 24 hours, and then there's a rewarming period. And it sounds pretty simple, but it requires very, very intensive supervision by very highly trained nurses in the ICU setting. But the concept there basically is, if we sprain our ankle, we ice it. Well, it's a good thing to take care of the brain, too. It preserves brain function and here's the proof.
I want to ask you, though, this is not something that's done routinely, is it? I mean, El Camino really has been on the forefront of hypothermia, haven't they?
El Camino has been on the forefront, and what's amazing is how little it is used across the country. I think a lot of people don't know about it. They don't have these protocols in place. It doesn't require complex technology. These are patients that generally are going to be intubated and in the ICU anyway, but the difference is that you're going to put them on a protocol that you have to start instantly and quickly, and the main reason for that is, just like time is muscle for the heart with the balloon procedures, time is brain function in this case in terms of cooling.
Thank you. Terry, what do you remember about your hospitalization? Do you remember waking up in a cooling blanket like a burrito?
Nope, I remember nothing of that. There was a week of time there that I really do not remember, although my family has told me about it, and it was very traumatic for my family because the kids were all there and as well, and so they actually, when they brought me out of the hypothermia, they actually requested that Bill and the family be there, and because they don't really know, since it's for your brain, they really don't know how much of your brain function is really going to be there and when you come back out. So that was very scary for everybody else. I had no clue any of this was going on. And so, but they, when they brought me out, they evidently asked questions, and I was holding their hand, and they were trying to get me to squeeze their hand if I could figure out what they were saying. And so I guess the first time I squeezed their hand, then them and the nurses and everybody cried. So it's not a trivial process, but I think it mostly worked. I think I'm mostly here.
So
I think what my daughter said finally was, I'd said some smart-ass comment, and she says, "Oh, Terry's back."
So, Bill, what surprised you most about this experience in the CCU?
Well, I guess what surprised me, before I talk about that, I do want to say one thing. And I've been in a lot of high-tech environments, launched spacecraft and flown them in orbit around the Earth and so forth, and supervised those things. The operation they run, El Camino runs in the CCU, is absolutely incredible. The nurses who oversaw the hypothermia were probably some of the most talented technical people I've ever met. It was a scene out of just constantly monitoring, balancing, checking every aspect of the care she was getting. And the two things that I was most impressed with, one, they talked as if she was conscious and awake, and they also shared with us at a very understandable level exactly what they were doing. And that was just a tremendous benefit. And that aspect of talking to the patient as if they were conscious, I think was just really something they did extraordinarily well. And it continued through the CCU and then into the TCU. At one point I asked them, well, if we're worried about our brain, why don't we put EEG leads on her or something to see whether our brain is functioning? And they said, at 91 degrees Fahrenheit, there wouldn't be any signal.
Wow.
Oh, wow.
There's no point in doing that.
So I just want to validate this. You work for NASA? You orbited the Earth, and you thought the care here was spectacular?
No, I supervise spacecraft up there.
But still, NASA. They always say if you could put a man on the moon, right? Right? And so can I ask you, it's only been a few weeks since your induced hypothermia. What is your life like now, Terry?
I get tired easily still. And I I'd say that's the biggest thing. Well, that's not the whole story yet.
Right.
I mean, I came out of hypothermia, and then Dr. Bing Liam, so that was, sort of, that was taking care of some of the plumbing in the sense of the brain, and so forth. But the real issue with me had been not a plumbing issue per se, but the fact that there was an electrical problem as well. So I now have my personal pacemaker and defibrillator. So that was the surgery that I had. So that's part of the reason that I suppose that I'm tired now. And but that was February 5th. So I'm going to start the cardiac rehab program, but I have to be 6 weeks away from surgery, so that I don't get to start till the end of March.
They're waiting for you.
So because Terry had to have the paddles, right, the defibrillation, you now have a pacemaker that's implanted.
Right.
Go ahead, Terry.
And it effectively will give me the paddles if I need it.
It will give defibrillation. Dr. Curatola, can you explain what's going on with that?
So what Terry has is a defibrillator. I think most of us remember it when Cheney got it. A lot of people refer to it as a pacemaker. It has pacemaking ability, but its primary function is to recognize when there's an arrhythmia that's a life-threatening arrhythmia, allow that arrhythmia to go long enough so that the patient gets lightheaded and is unconscious before they get jolted. And I have more patients than I care to share with you whose lives have been saved by those. There's something that you guys don't know and nobody else really knows, a little tidbit here, but an important tidbit. When I was an intern at Johns Hopkins, this is around 1980, in that range, the first defibrillator that was put into a human being was a patient from this area. It was actually a patient of Dr. Roger Winkles, who's in Sequoia now, but he was at Stanford at the time. Got transported to Baltimore. The guy who invented it was in Baltimore. And the defibrillators then were like the size of a battery, about this big. They got put into your abdomen. A cardiac surgeon had to open your chest. You had patches put on the outside of your chest, and then you had, literally, this is like a battery. And this was before HIPAA and all the privacy laws, so somewhere in my files and boxes somewhere, I actually still have an X-ray of the first defibrillator that was ever put in. If it happened today, you go to jail. I mean, it's all these HIPAA violations, but back then, nobody cared. That now has gotten to the point, that technology that I just described to you, which required a cardiac surgeon, a general surgeon intra-abdominally, and a cardiologist, is now done by a cardiologist in our cardiac cath lab with an overnight hospitalization in most cases. In your case, it wasn't elective, yours was emergent, but in elective cases, an overnight hospitalization, and it's a pocket under the skin.
Yeah, I actually have two separate devices. Mine are stacked. I actually, and then one of them is about that big around and about that thick, and the other one is smaller, and so they're actually stacked on top of each other.
They're all in one case.
They're all in one case, but they're basically stacked in there, and so it's I have my own private one now.
Yeah. So after all that the two of you have been through, and I'd like to ask both of you to answer this. What advice would you give to other people? Terry, I think I'd like to start with you. What advice would you give to this audience?
Call 911.
Right on.
They were amazing, in terms of the help that they gave Bill over the phone. I mean, if he hadn't, he's my hero. If he hadn't started CPR when he did, and then, them following up when they got there, I wouldn't be sitting here. So call 911, the first thing, and unlock the door. I had a number of bad reactions during chemo, and so we had previous experience with 911, and I just can't say enough about how good they are. So whenever you even think you might be needing it, call them, because for one thing, If you call them and they do the EKG and there's a problem, that means there's somebody already here waiting for you. You're not, filling out paperwork when you get here, and that can make a huge difference.
Good point. Good point. Excellent. Bill, what would you add?
I would add, they took her in the ambulance to the hospital. They tell you to follow, of course. If you don't have the doctor on the line like we did, call your doctor for the person who's going to the hospital and let them know that your wife or whoever spouse is going to be arriving at the ER, because it's your personal doctor who knows you. And I think it's important to have someone who knows you to run interference here at the hospital, because their machine kicks in, and they would have done if I hadn't been there, if Coratola hadn't been there, they would have done an angiogram, and that would have delayed getting her into hypothermia. So having someone there to speak for you from the medical background, I think, is very important.
So, Dr. Curatola, given Terry and Bill's experience, what advice would you give to the audience?
Well, what I wanted to end this segment with, Terry said. If you even stop and think, whether it's chest pain, a lightheaded episode, but certainly if you witness a fall, there's very little to lose by calling 911 and having someone who's technically and professionally trained to determine whether or not it's serious. If they come to your house and it turns out to be a simple faint, you lose nothing. If you hesitate to call them and it turns out to be something more serious, it could be life-ending and certainly life-altering. So, recognition and quick action.
Yeah, we had a previous experience where I had fallen down the stairs, and we decided that I could move my head okay. So he just took me to the hospital, and we got the lecture of our lives when we got there, because I had gone into shock. Fortunately, just as I hit the door of ER, but I just started shaking uncontrollably all over and had gone into shock. So we should really have called 911. So we got a great big lecture, and we've been good since then.
Obviously, you're an incredibly strong woman for everything that you've been through and how well you've done. So thank you for sharing your story.
Well, thank you. And Dr. Curatola, I'm going to...
Thank you.